Hey everybody, Chris Mullen back with you again here at Mercy Health Lifelight, clinical educator here. What we're going to do right now is we're going to go ahead and we're going to put in a set of nasal cannulas for the Airvo 2 for a neo-peds child. And we're going to utilize this mannequin just to demonstrate. Now I want to make sure that we really reiterate the fact that this therapy, which has been found to be quite helpful in reducing the amount of intubations that we're doing in a lot of these respiratory kids, and it also has been identified to actually reduce the amount of nosocomial infections while the patients are actually in the hospital as opposed to an intubation. That being said, we're going to go ahead, and our focus in this brief video is to show you how to hook up how to size them and how to put on the cannulas and hook them up to their therapy. We went ahead and we did the therapy setup and the machine setup in a prior video. So you're more than welcome to go back and look at that. What I want to point out is a few things. Once we have this hooked up, the regular hose here, it's giving me a little error alarm because we have a leak because we're not hooked up to anything. So that being said, let's go ahead and identify a few things. Your usual hose here will also need a junior adapter, the junior adapter. So if you don't have this, you won't be able to hook into the system. So this piece actually will go onto the adult size tip, and the thing that happens is you're going to put those two little flanges right there inside of this hose. This should remain on and you'll see it looks just like so. Okay? Now you're going to have to find out what size you're going to use. So what they did, which is kind of nice, they gave you a gauge on the side of your packaging, and it tells you by looking at the nares which size they should be. So for this situation, we're going to go ahead and we're going to utilize what they have marked as an octopus. Now it has their little icons right here, and that correlates to the size by looking here. So there's our little octopus. So we're going to go ahead and we're going to use this for training. And make sure that you do not block up more than 50% of the nares, because we want to be able to have air go in and come out. If we block it, we're going to end up with a situation of some increased pressure. So you're going to go ahead and take the actual cannula and you're going to insert it into the nares. Now I know this is a little tight for this one, but we would use probably a smaller one in a human. We want to make sure we have totally 50% available. These are called wiggle tabs, and if we go ahead and peel these back, we can go ahead and secure it to the cheeks. You want to secure it to the cheeks. The reason is if it gets rolled up and it gets tugged on, it's going to block that airway, and this child could end up with some increased pressures and do some damage. So go ahead and tape those in place, and then we're going to take this cannula and we'll go all the way around the head, nice and neat. Okay? And then all we're going to do is take that tip and we're just going to insert it right in here. And we now have a secure closed circuit. So what you're going to do after that point is you're going to want to make sure that we monitor this child. You're going to want to watch that SpO2. You're going to want to watch the respiratory efforts of this child. That is a huge portion of what we do. Because could this child deteriorate and need intubation? Absolutely. But that is how we go ahead and put the Airvo 2 into place for neo-peds. If you have any questions, please feel free to reach out. Thanks.